Hi, you guys. Welcome back for our daily practice questions. It is day 69, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Before we get started, quick reminder, if you're looking to join my upcoming 5-week intensive review, it starts April 21st and runs through May 30th. I have 3 spots remaining. Click the link in the description if you're looking to join. All right, question number 1. All right, today we are covering the hepatitis B serology, and I am starting you from a knowledge standpoint. So these are going to be really straightforward questions because I get a lot of you guys that, and especially like in my one-on-one sessions or my reviewers, y'all say that y'all struggle with these. So I want to kind of break it down a little bit more so then you can apply it to the serology panel tomorrow, okay? So question 1, which of the following serological markers indicates an active Hep B infection? Is it A, the anti-HBs, B, the anti-HBC IgM, C, the hepatitis B surface antigen, which is the HBsAg, or is it the hepatitis B E antigen? Take a moment and tell me what you got. All right, typically I'll tell you to read the stem of the question. Here, the stem is the question is the stem, right? Knowledge-based question. Which of the following serological markers indicates an active Hep B infection? So which marker indicates an active Hep B infection? And it's C, right? Remember, I always tell you guys to pay attention to 2 areas when you are first looking at the serology panel, and it's going to let you know if they have the infection currently or if they have antibodies for either being vaccinated or previously having it, right? But the one thing that I tell you is to determine if they have the infection. It is C, the surface antigen, right? Hepatitis B surface antigen. Remember that. All right, question number 2. In a patient who has cleared a hepatitis B infection, which of the following serological markers would most likely be detected? Is it A, hepatitis B E antigen? Is it B, the hepatitis B surface antibody? Is it C, the hepatitis B surface antigen? Or is it D, hepatitis B core antibody with the IgM? What do you think? Tell me in the comments. All right, so again, stem is the question is the stem. In a patient who has cleared a hepatitis B infection, which of the following serological markers would most likely be detected? And it's B, right? The anti-HBs. Just like in question 1, remember I told you there's 2 areas I tell y'all to focus on. The surface antigen lets you know if they have the active infection, right? So if you have a positive hepatitis B surface antigen, which is what you see at the answer choice C, the HBsAg, if that is positive, just like in question 1, that means they have the active infection. But I also told you the second thing is to determine is if they have antibodies. They're either going to have these antibodies from the vaccination or from previously having the infection, right? And that is your anti-HBs. I always say think anti for antibodies. Don't get them mixed up. So B is your best answer here, okay? All right, and then question number 3. What does the presence of hepatitis B core antibody, IgM, indicate? Is it A, a chronic Hep B infection? Is it B, a recent acute hepatitis B infection? Is it C, immunization against hepatitis B? Or is it D, clearance of the hepatitis B virus? Take a moment and tell me what you got, y'all. Tell me what you got. All right, so what does the presence of a Hep B core antibody IgM indicate? And your best answer is B, the recent acute hepatitis B infection, right? Remember, so when you see that anti-HBC or if you see core, remember the core is simply talking about the IgM, those markers, and IgG. Remember, IgG is chronic, IgM is acute, right? So again, the answer is B, recent acute hepatitis B infection. All right, you guys, so I wanted to take a moment to do it from a knowledge perspective to just pinpoint specifically what these markers mean so that when I actually give you the panel tomorrow, I want you to be able to try to apply this knowledge and walk yourself through it. I think you can see it a little bit better because when you get all of those things listed, I think we get overwhelmed and it becomes confusing because it's just all these letters like the alphabet soup, and a lot of it is not pertinent to the answer choice. Now you will know it and understand which ones are what you need to utilize in practice. But if it's asking you to be able to diagnose what this serology panel is showing, I need you to be able to identify if they have the infection or if they have antibodies, if it's acute, if it's a chronic. And that is what you should be able to approach from knowing these from this area. Okay, so you'll see what I mean with now applying, and I hope that you found this helpful to kind of pull out what it means from this perspective. But let me know your thoughts. Let me know if you have any questions. But as always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And as always, if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked here in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.